All right, this is for health assessment. This is my head to toe assessment. I'm going to provide privacy. I'm going to introduce myself as her nurse. I am going to start my assessment now. Can you give me your name and date of birth?
Jane Doe 17 of 83.
And can you tell me where you're at?
I'm at the clinic.
And time of day?
It is afternoon.
So you're alert and oriented ×3. Your mental status, have you had any changes in mood? So no mood, no mental changes, no mental status changes. Her hygiene is appropriate for the weather today. She is wearing clothing that's appropriate. Her hair is clean. So next we are going to move on to skin color. I am going to look at it throughout the whole process. Her posture is proper and it's aligned. Her mobility is, she's independent because she walked herself here to the clinic today. She's able to speak and hear clearly because she's able to talk to me. Throughout the process, I will be looking at her skin. I will be checking the color, the pigment, moisture, turgor by pinching the skin, temperature, texture, and looking for any lesions. Her skin is dry, it's not moist. It is the color of a Caucasian female, and there are no lesions or anything of that sort. Her head and face, her scalp and hair is that of a female. It is long. Her cranium is normal. There's no lesions, bumps, or anything of that sort. Can you show me, can you smile for me? Can you puff out your cheeks? Her face is symmetric. I'm gonna palpate her sinuses, the frontal and the maxillary. Can you open and close your jaw? And there is clicking, which would be consistent with her TMJ diagnosis. I am going to look for her, the artery, and the temporal artery is not descended or visible. I am going to now ask you to read to me the last line.
On the bottom.
Whichever one you can.
2, 3, 4, 5, 6, 7, 8. And your fingers on 9.
Okay. Oh no, I mean like one of these. Sorry.
8, 7, 4, 5. EMW.
Yep. So your vision is 20/70. It says. Her eyelids are symmetric. Her eyebrows are symmetric. Her, let's see here. Her face is the normal color of her skin. She doesn't have any lesions or imperfections. She has freckles, which are present, but is common for a Caucasian female. I am going to look within her eyes. And her pupils are the same size. Perla is present. Her sclera is white and clear. Her cornea is transparent and her iris is present. Visual fields, I am going to hold my hand here and I'm going to go out here and I need you to tell me what number I have up in my fingers.
2.
How many do I have? How many do I have here?
3. 3. 3. 2. 2.
Okay. Visual fields are normal. I'm going to now do the extracular muscle, and so I'm going to point my finger. I'm going to move out, up, down, over, up, down. Okay, all within normal. I'm going to look for the corneal light reflex. I'm gonna have you look straight ahead, have your eyes open, and I'm gonna put the pin light towards the bridge of your nose. Okay. And the light reflex is symmetric. The red reflex is, let's see, let me look. Okay, the pupils are dilating, so Perla is definitely present. The red reflex was not visible. We know that it's there. The room just isn't dark enough. I guess maybe I could use this, and I probably would be able to see it. It is present. I am going to palpate the ear. The upper part is hard. The bottom part is soft. Is there any tenderness with that? Any tenderness with this?
No.
Okay. And now we are going to check for the lymph nodes, the preauricular and the posterior superficial cranial chain. And now I'm going to do the whisper test. Repeat what I say.
Hi, John.
Okay, that worked. I'm going to do the Weber test. So this test is conducted by, I'm going to hit it. There's going to be vibration. I need you to tell me when you no longer hear it. Okay, so I am going to hit this part of my hand. I have to do it that way. Can you feel vibration?
Mm-hmm.
Okay, tell me when it stops. Okay, so that is within normal. Now I am going to do the Rhine test, and what I'm going to do is I'm going to put it on the back of here. You're going to tell me when you can no longer hear the vibration, and then I'm going to move it up here, and you're going to tell me when you can no longer hear the vibration. And I am going to set a watch right here, so I can, oh, that's not going to work. And I'm putting this on the mastoid process. Okay, tell me when it stops. Okay? Now tell me when you can no longer hear that. Okay, and that is all within normal. It is double the amount of time that was on the mastoid process. Now I am going to check the inside of your ears with the otoscope. Her ears are clear. There is no wax present. The canal, it looks healthy. There's no inflammation. And it's clean. Okay. All right. So now I'm going to inspect the nasal. Her septum is midline of the nose, which is normal. Now I'm going to look up into her nasal. The mucosa is, she has no mucus, it's dry. It's red, not beefy red, but red in color. And you can see the septum, which is inline, midline. There's no swelling, no polyps. The mucosa and septum is present. Can you blow through your nose? The other side. So the nostrils are patent. I need you to identify smell. So I'm gonna just give you this and I'm gonna have you smell it. Can you identify what that is?
Coffee ground.
Okay. All right. I am going to look into your mouth now. I am going to use a different cap. I am going to have you open up your mouth. Let's see if I can turn this on. And say ah. All right. There are no tonsils present. The mouth is pink. It's moist. No cavities were noted. Let's just make sure. The tongue doesn't have any cracks, is normal of a normal person. Can you stick out your tongue? Okay. All right, that's within normal. Now I am going to inspect the trachea. And the trachea is midline. I'm going to test for the jugular vein. The jugular vein is not distended, which is a normal finding. I'm going to have her do cervical range of motion. And by doing cervical range of motion, you are going to go side to side, front to back, and then chin to shoulder. Okay, that's all normal. She has full range of motion. I am going to now palpate the trachea. Okay. I am going to palpate the thyroid gland. The trachea is more like this. The thyroid gland is right here, and it is not distended. It is normal. Her carotid, I can feel bilaterally. Lymph nodes, there's no swelling. Is there any pain or tenderness associated with this? Nope. Okay. And then now I'm going to feel her muscle strength in her trapezoid. I'm going to have you shrug your shoulders. Okay. That is 5 out of 5. Her mastoid, I am going to have you do the same thing. And I would say that that is 5 out of 5 as well. I am going to listen to the carotid and listen with the points. I need to twist this. I'm able to hear the carotid artery through listening to it. I am going to now put an object in your hand. I want you to close your eyes, and I am going to put something in your hand. Can you identify this?
Chapstick.
Okay. I am now going to write a number in your hand, and I want you to identify it.
Number 2.
Okay, you were able to do both. Now we are going to do range of motion of your shoulder, and I am going to show you how you can do that. Your shoulder is going to be like this. Or no, I'm sorry. Shoulder is like this. Okay, keep going up and down, front to back, and then circular. Okay, now we are going to do the elbow, which is in and out. Okay, we are going to do the wrist, which is like this, and then circular. Okay, fingers go like this with your thumb. I'm gonna feel yours. As tight as you can. Okay, those are equal bilaterally. Finger movement, can you go like this, back? Okay, and I'm just gonna feel your muscle strength there. Can you do that again? Okay. All right, so now I am going to do muscle strength for different muscles. I'm going to have you, we're going to kind of be doing the same thing as we did with range of motion, but I'm going to be feeling your muscles. So I want you to go like that. The deltoid is 5 out of 5. Or I'm sorry, that's the bicep. I'm going to have you do the same thing for the, okay, the deltoid would be 5 out of 5. And the tricep as well. The wrist, I'm gonna just have you go like this and go up. I'm just gonna feel, okay, that would be 5 out of 5 as well. And the fingers and thumb, open it wide. And as I try to push your hands together, try and prevent me from doing it. Okay, that is 5 out of 5. I am going to check brachial pulses now. I'll do one at a time. All right, those are bilateral. They're both palpable. Now I'm going to check your radial pulse. Okay, that is palpable. Both are strong and regular in pulse, regular rate. All right, now I am going to perform reflexes on the bicep, the tricep, and the branchioradialis. That's how you say it. All right, so I'm gonna have you do this. Okay. Oh, I don't have to do it on both. And now your tricep, I'm gonna have you go like this. Okay, and then I need to do it right here. And just... Okay, weird feeling.
Yes.
All right, now we are gonna do sensation. Tell me if you can feel this. And this would be the pain sensation.
I can feel it.
Okay. And this would be
Yeah,
light
I can feel it.
okay, you can feel that.
Mhm.
Okay. All right. And vibration. All right, I'm just gonna do it on your elbow here. Can you tell me if you can feel it?
Mhm.
Okay. All right, so now I am going to check your posterior chest. So I'm gonna have you turn, come sit over here, and I'm gonna try and stay within the camera here. Yeah,
Right
like
here.
that.
Okay.
Okay, so her back is symmetric. It's concave. It has a convex curve, which is all within normal limits. I am going to feel the spinal processes throughout her back. They are present. Okay. Was there any tenderness involved with that? There's no bulges. And now we're going to check the thoracic expansion. So I am going to have you shrug your shoulders. Okay, that is all normal. Okay. Now we are going to go do the tactile for dermatitis. So I'm just going to feel here. And that is all normal. Now I am going to check her chest wall bilaterally. I am going to percuss. And I don't know, I hope that you can see me. Tell me if you have any pain with this. Is there any pain?
Nope.
Tenderness?
Nope.
Okay. So we will then look for CVA tenderness. Do you feel any pain with that?
No.
Okay, no pain associated with that. Now I am going to listen to her posterior and lateral chest wall. All right, so I have you take deep breaths. All right, everything is normal. Now we are going to check her anterior chest for respiration, movement, symmetry, and retract. I'm going to have you breathe normal. And her chest is symmetric. It retracts the way it should be retracting, and her respiratory movement is normal. I'm going to just do your respiratory. And her respirations. They are 18. All right, so now I am going to palpate her PMI, which is, sorry, it's right under here, and that is palpatable. I am going to check your thoracic expansion in the anterior. So I'm going to have you lift. Yep. And that is all normal. I am also going to check your tactile femoris anteriorly. Okay, and that is all normal. And then we are going to discuss the breast exam. So if you were at home doing a self breast exam, you are going to make sure that you are checking your checking for any imperfections like dimpling, masses, and you're going to do it in a circular position around. You're going to check your areola, make sure there's nothing, make sure there's no drainage. If there is, you would want to go in. You also want to make sure that you check your armpits as well, your armpit area, because you want to make sure that there's no swollen lymph nodes over there that could possibly be breast cancer. You want to make sure the skin is smooth and even color, and you use your finger pads when you're going in a circular motion. So now I am going to palpate or feel your axillary lymph nodes. So I'm just going to, you can just relax. There we go. And there are no swollen areas there. I am going to listen to her chest wall. Or actually, no, I'm going to percuss the chest wall. Sorry. So I'm going to do that. Anything, any tenderness, pain associated with that? Okay. Now I am going to listen to her anterior chest wall and listen for an apical pulse. So. Okay, the apical pulse, the rate and rhythm is normal. All right. And now I would check with the bell of the diaphragm of the stethoscope. I would be checking the A, P, E, T, and M. We can try to do that. I don't know how successful we will be. Sorry. Okay. All right. I am going to now have you lay down because I am going to do the assessment on your abdomen. Here, let's see if we can move it. Let's see, there we go. All right, so now I am going to listen and look at your stomach. Sorry if I know this is probably uncomfortable. All right. Okay, pulsation is noted. The umbilicus is central. The surface is smooth. The contour is protruding slightly, but that would be normal. And then I am going to get at eye level now, and I'm going to have you hold your breath in. Hold your breath in. Okay. And the contour remains smoothly and is not distended, and it's symmetric. Okay, we are now going to move on to, I still need your stomach. We are now going to move on to listening to the 4 quadrants, the vowel sounds, and the aortic brute. So, Okay, vowel sounds are present in all 4 quadrants, and the aortic root is also present. I am now going to palpitate lightly. You tell me if there's any soreness or tenderness with this. Now I'm going to deep palpate. You tell me if there's any. Okay. And now I am going to tap on all of them. You tell me if there's any pain associated with that. Okay. Now I am going to look for the femoral pulse, and that is present. I am going to feel for the lymph nodes, the vertical and horizontal, and none of them are able to be palpated, which would be normal. We wouldn't want them to be able to be palpated. Now we are going to go over testicular exam. Testicular exam consists of, sorry, we won't be able to see you if we don't do that. Testicular exam, you would hold the penis out of the way, check one testicle at a time, and you would look for any hard lumps, smooth round bumps, or changes in size, change, and consistency of the testes. Now we are going to do range of motion, and we got to do this quick. Range of motion of the hip, I am going to actually have you lay back down, and you're going to have to lift your leg up. Okay? Are you having any pain or tenderness with that?
No.
Sorry. I can't see that. Can you do that again? Okay. Now I am going to have you move your knee up like this. Any pain or tenderness with that?
Nope.
Okay. Ankles, I am going to have you move your foot up and, yep. Circular. Any pain with that?
Nope.
All right. And then the feet, I'm going to have you go up and down. Any pain or tenderness with that?
No.
Okay, now I need you to run the heel of one of your feet across the opposite side.
Should I stand up or just do it here?
Just do it right there if you can. Okay. Now we are going to, you can staying there. We are going to check the hip muscularity, the back, which is in the back of the leg, the upper part. So I'm going to have you, go up. Okay, and that would be a 5 out of 5. I am going to have you do the same thing so I can feel that. Okay, and that would be a 5 out of 5 as well. Ankle and foot muscles, I'm going to have you do the same thing. Go up and down. Okay, and the strength would also be 5 out of 5 for that as well. I am going to palpate now the popliteal pulse, which is back here. Okay, that is palpable. It is present. The tibial pulse. Let's see if I can feel it. I'm just trying to make sure that the video is. Okay, both of those are present. And now I am checking for the pedal pulse as well. Okay. And that is present bilaterally, all within normal range. Now we are going to do the reflexes of the knee and her ankle. So I'm going to have you sit up. Let's see. Let's see this. Okay. So I am going to, okay, that is, and then the ankle, and let's see. Okay, all right, and now I'm going to have you do the sensation to pain again. Are you able to feel this?
Yep.
Okay, and light touch.
Yep.
All right, and then vibration. Are you able to feel that? Okay. Now I am going to have you do a few steps here for me. Her gait is normal and would be a normal person. She doesn't have any issues with gait. She's an independent person. I am going to have you walk heel to toe.
That way?
Yep. I don't know if we can videotape this. Okay. Now I'm going to have you do spine range of motion. which would be up and down, side to side, and rotation.
Okay, up and down.
Yep. Side to side,
Side to side.
and then circular motion.
Like-
go like this.
Actually, okay.
Okay, that is all normal. Now I'm gonna have you touch your toes. Okay, and now I'm gonna have you do the Romberg. I am gonna have you put your feet together, arms resting, and open your eyes, and then close your eyes, and I'm gonna stand behind you in case you were to fall. Okay, that is normal. Now I'm gonna have you close your eyes and lift one foot up for 5 seconds. All right. Now I'm going to have you walk in tandem, which means heel to toe.
That way?
Yeah, you can go that way.
Heel to front.
Yep.
Okay.
All right. She is able to do that. I am now going to have you hop on one foot and then hop on the other foot. Okay. I am going to have you put one hand out and knees bent. Knees bent, both knees. Okay. That is good. And then now I'm going to have you walk on your toes. Walk on your heels. All right. And she is able to do all of these, which would mean that she has normal gait and no concerns at this time. This ends the assessment.